Hello and welcome to this special show. We are in conversation today with Dr. Srinath Reddy, President of the Public Health Foundation of India, the organization that has now come at the heart of this entire controversy on foreign funding for organizations, the anti-tobacco lobby versus the tobacco lobby. Thank you so much, Dr. Reddy, for speaking with CNBC TV 18. First up, let's get straight to the core of this entire debate and controversy. How far have you moved as far as your discussions with the Home Ministry is concerned in terms of your submissions? What's the status on the cancellation of your FCRA license?
Our FCRA license was renewed for 5 years in August 2016. And then in April 2017, we received an intimation that the renewal letter was annulled, which means that we had no longer a valid renewal. And we did not receive any prior notice for clarifications earlier, but some issues were raised and we responded to them both in April as well as later in June with great detailed submissions. In fact, we had meetings with the Home Ministry officials in May and we did some verbal clarification as well. But in June, we received a supplementary list of many questions to which we replied in June. We have been subsequently meeting them on several occasions in August, and whatever documents they have demanded, we have provided. We understand the matter is still under their review, and we are hoping for an early resolution. Already almost 6 months have elapsed, and we are fairly concerned about the damage it is doing to PHFI. And therefore, we have also represented the matter to different officials in the government, both in the Home Ministry as well as elsewhere, including the Prime Minister's office, hoping that the review would be expedited. The Health Ministry, of course, is fully informed, and I believe they are also pursuing the matter. So we are in expectation of a review being completed. And
any timeline or indication that you've been given that this is when the review would happen?
No, we have not been given any timeline for conclusion of the review, but we know that the review is ongoing.
If we talk of the issues that were raised, by the Home Ministry, you said they had sought some newer clarifications in June as well. What do they relate to? And in your assessment as PHFI, where do you see those concerns standing?
Firstly, there are major issues related to our supposed lobbying for tobacco control, which is actually advocacy. But in our case, it was mostly implementation research and dissemination of information related to that, and synthesis of research for policymakers to consider.
Right.
That we do not consider as lobbying. In fact, the word lobbying doesn't figure in the FCRA Act itself, so it's not defined. But we believe that what we have been doing is fully in consonance with the National Tobacco Control Program, the country's commitment to the Framework Convention on Tobacco Control, and the newly delivered emphasis in the National Health Policy, where tobacco control has been reiterated as a major commitment of the government.
Right.
So we believe we are fully acting in concert with the Health Ministry's own directives. And quite often, most of these activities have been done with the prior approval of, in partnership with, and subsequent appreciation by the Health Ministry. In fact, 2 of the activities which are conducted, which have come under the Home Ministry's observation, have been done in the states of Gujarat and Andhra Pradesh between 2011 and 13 in partnership with those respective state governments.
Right. But there are also issues on the financial front. I'll come back to the tobacco lobbying part in a bit, but there are also issues on financial aspects.
We believe that most of those issues have been based upon incorrect understanding of the facts. For example, some of the numbers have been double counted, and therefore they have come up with figures which are a deviance from what we have submitted. So we have very clearly outlined where those differences arise from.
Right.
And there have been other issues related to our use of 2 PAN cards. One was actually an erroneous PAN card issued by the Income Tax Department as a corporate entity, whereas we are a society.
Right.
And that particular PAN card was then replaced by the Income Tax Department with the right one. But in between, whatever transactions took place had to be reconciled further. And ultimately, the first PAN card was actually surrendered to the Income Tax Department, and their own communication says that 2 cards were issued by an inadvertent lapse
on their part.
Well, the question is, nobody actually meant any harm there, and everything was in full disclosure to the Income Tax Department in every filing, and so was it to the FCRA filings.
But now when you've submitted all these documents, you're saying you've responded to all the queries, the fresh queries that were raised in June as well.
Yeah.
Has there been any sort of indication or from the Ministry of Home Affairs as to where does this review process stand? Has their stance slightly softened as far as this entire issue is concerned?
I believe that they are looking at the documents that we have submitted in great detail. It is difficult for me to say what their conclusions are at this point in time, because whatever communications we have had with them have been either verbal or through documents that they've asked for and which we have submitted. It is not possible for us to say when they are likely to conclude the review, though certainly we hope it will be an early decision.
In case the decision is not in the favor of PHFI, is there a possibility for PHFI to take a legal recourse or a litigation to sort this matter? Because if you say that all your paperwork is in place and there is nothing off the mark here, would litigation be a recourse for you?
That is a matter for our board to decide. The PHFI board will review the matter during its next scheduled meeting in October. We'll study what the situation is then, and then it's for the board to decide how to pursue it further. So far the board has been very consistent in its stand that since we are an organization started by the Ministry of Health and we are closely linked to the Ministry of Health, these matters should be sorted out through dialogue and explanation at the governmental level. But if there is any need to take recourse to a legal redressal, that's a matter that the board will consider in October.
Okay. In a recent interview, you had said that you are on the list of the tobacco lobby, the global tobacco lobby, and you are seen as an adversary. You think there is this tobacco lobby which is behind this entire controversy, the FCRA license being cancelled for PHFI and the entire bit that is being...
Well, that particular interview was given in the context of the Philip Morris internal strategy document being published by Reuters, in which we all found to our surprise that among the 8 global public health leaders who were considered champions of tobacco control, my photograph featured, but what was surprising was that mine was the only photograph with a red circle around it. So which suggested that there was some targeting being done, possibly in the context of the Conference of Parties that was being hosted by the Government of India in November 2016. And I was a member of the Indian delegation. And since I had played a major role in the original negotiations between 2000 and 2003, I might have been seen as a major adversary, and I was circled as such. So the interview took place in that context. But there's no doubt that the tobacco industry views us in PHFI as an enemy. For example, we have seen consistently the chairman of the ITC in the past, from 2015 onwards, issuing media statements or interactions with media, making remarks that foreign-funded Indian NGOs are hurting Indian tobacco-related economy. And in fact, in April 2016, he did tell the media in Guntur that the ITC had passed on information related to foreign-funded tobacco NGOs to the government for initiating action. So it is very clear that there has been a considerable amount of influence that the tobacco industry tried to exercise. Whether they actually succeeded or not, I cannot say. But they did not spare efforts to paint us in black colors. And you have seen the poster campaigns.
Yeah, I was just about to ask you, because after the FCRA license cancellation, there were posters thanking the government to take action against...
not only thanking the government for listening to us.
Okay.
I mean, basically which says that they actually interceded, asking for action against us, and they were thanking the government for listening to them. I mean, that may be a tall claim from them. I mean, I believe the government will have independent judgments on of its own. But the fact that the tobacco industry did lobby for action against the tobacco control NGOs is a self-declared truth.
So the machinery was at work. Whether the suggestions were taken by the government or not would be a separate
that is not a conclusion I can reach on the basis of whatever facts I know.
Post your FCRA cancellation during the latest ITC AGM as well, the chairman had mentioned that it was a good move by the government to have cancelled licenses for NGOs that were, the anti-tobacco lobby. But sir, how do you see this entire thing work, in the current scenario? There is fair bit of debate happening around the entire tobacco bit. There is a PIL filed by the Tata Trust that says that the government should not be investing in companies that are into tobacco, like the ITCs of the world. Then there is this entire PIL and litigation against PHFI and organizations like that. The license is being cancelled. How do you see the scenario right now? Where do you see this headed?
When I was a member of the Indian delegation between 2000 to 2003, and our health minister for a substantial part of the delegations was Mrs. Sushma Swaraj, the Indian delegation took a very consistent stand that the FCTC must protect the interests of farmers and those working in the tobacco industry by providing economically viable alternate livelihoods.
Right.
So that is something that we clearly recognize and we also definitely advocate for. However, the solution does not lie in slowing down tobacco control, but in hastening the transition to alternate crops and alternate livelihoods.
Right.
We cannot afford to let more than 1 million Indians die every year. Many children and women get entrapped into this new habit.
Do you see that move happening?
Well, I believe it requires a policy decision which will result in multi-sectoral action. We have not yet seen that kind of a policy being implemented where there is a very clear-cut plan for transitioning people from tobacco to alternate crops or from tobacco industry to alternate occupations, including the BD workers. But it is necessary, and we will definitely want the government to act in that direction.
And the BD workers and the tobacco farmers are the ones who also filed a case against PHFI in the courts.
Well, they see us as the enemy, but we are not. In fact, if you look at it, the tobacco crop is not going to disappear in the next 10 years because all the tobacco consumption decline is going to happen at a slow pace. And the population growth also will slow down the number of, will actually result in a fairly large number of new people consuming tobacco. So it will take a couple of decades at least for tobacco to become a declining crop and a declining industry, which we hope it will be faster, but it will take that much time.
Right.
During that period, there is enough time for transitioning people to alternate crops, to alternate occupations. And the BD workers are not rising above the poverty line because of their engagement in the BD industry. They are actually seasonally employed. They suffer the occupational hazards of working with tobacco.
But do you see there in this segment also a push by the tobacco lobby?
Obviously, the tobacco industry, which has major stakes in terms of profits for themselves, would like to use the farmers and BD workers as a front to protect their own interests. I don't think that the farmers and workers are being served well, certainly not in the long run, because if the tobacco demand declines globally and in India as well, then where are these going to be people? They're going to be left high and dry.
Right.
So it is time that we refocus on transitioning them to other occupations and crops.
Right. When there is a very clear indication that there is a strong industry lobby working against PHFI and similar such anti-tobacco advocacy groups, so to say, how does PHFI in particular intend to deal with this situation? Till now, everything was behind curtains. There has always been lobbies on all sides. Now it's up front. How does PHFI intend to deal and fight this?
Courage, conviction and calmness. We will retain our commitment to our convictions that we stand steadfast in our advocacy for tobacco control.
But here you are not getting much support from the government either.
Well, we will have to fight this battle for the people of India. We hope that the government, and the government is not a monolithic entity. The health ministry is fully for tobacco control. There are, I'm sure, other
but
people in the...
But this issue has also, you know, raised this, brought this up front that there is lack of, there is this, you know, lack of communication between the two ministries, or the two ministries are not on the same page. Don't you think that leads to a lot of concerns going forward for an organization like PHFI?
I leave that to the government to decide for itself how they should coordinate on these matters like this. I mean, H and health and home start with the same alphabet, so I hope they will talk to each other more often on matters of public interest.
Right.
It will be tragic if any section of the government feels that tobacco control, which is an accepted national policy, is inimical to national interest. It is certainly not. So I believe it's very important for the government to have a coherent policy on this, but I leave it to the conversation between the sections of the government. I cannot intrude into that space.
All right. So in the recent Indian Express interview, you had also said that you are the target of the tobacco lobby. And you had also made a statement that you would be willing to quit PHFI if it was in the interest of the organization. Now, I just want to put one very simple question. Do you think it is PHFI that is the target, or it is Professor Srinath Reddy?
I do not have any exaggerated sense of self-importance. That question was asked in the context of the Philip Morris document putting a red circle around me. I think PHFI is a very important organization which is advancing public health capacity in this country and is strengthening health systems. Tobacco control is only one part of our agenda. Its public health portfolio is very large and it involves many other elements. What I said is, if through the mistaken assumption that I, as a champion of tobacco control, am leading PHFI entirely or substantially towards tobacco control advocacy and neglecting other areas of public health action, then I would rather step out of the way and let PHFI do its work in the interest of the nation. I did not want to stand in the way. But I do not believe that my personal identity should be overtaking the identity of PHFI.
But how was this statement received internally at PHFI and the other advocacy groups that you work with? Because it's somewhere a very strong statement to make.
Well, actually, it was a leading question that was asked of me. I didn't volunteer that. But nevertheless, I do not evade questions, neither in this interview nor in that interview.
Right.
Well, as far as I was concerned, I was very careful in trying to state that PHFI's interest and national interests are foremost, and my personal interests take a back seat. And that is the truth. So internally, of course, my colleagues were rather upset. But externally, the tobacco control advocacy groups, as well as the larger public health world in this country, wanted me to stay on and resist any efforts by the tobacco industry to undermine public health. So they felt that my resignation would be a retrograde step. So different people have different viewpoints.
Right.
But no individual is indispensable. What matters is an organization that is wedded to advancing public health, and that PHFI is. With me or without me, that's what PHFI will do.
Right. There have also been concerns raised saying that PHFI has been working for multinational or big vaccine manufacturers, like in the interest of them. Your comments on that?
If I may use a not so polite word, that is nonsense. For the simple reason that we were providing technical support to the Ministry of Health for the National Immunization Program and Mission Indradhanush, which is the Prime Minister's own program. Now, the selection of vaccines are made by an independent group of experts headed by 3 secretaries of Government of India: Health, Health Research and Biotechnology. The vaccines are procured for the National Immunization Program from Indian vaccine manufacturers, not from multinationals. And all of these vaccines are WHO endorsed and are featured in the immunization programs of many other countries, including China, Brazil, and so on. So there is nothing that we have been doing. On the contrary, if you look at the report that we prepared for the Planning Commission in 2011, the high-level expert group report, or many of the other reports that subsequently my colleagues have published, we have consistently taken the stand that we must promote generic drugs, national capacity in vaccine manufacture, national capacity in essential drug manufacture, appropriate price control, so that access to nationally available vaccines and drugs should be part of our universal health coverage program. Nothing can be farther from the truth than to say that we are promoting multinational industry.
Right. Sir, in the light of the FCRA cancellation and paucity of funds, how has work suffered for PHFI? Briefly, if you could run us through what have been the key programs where you've lost out of because of paucity of funds?
Well, actually, we had about 70% of our research and implementation research funds coming from competed for international grants. There's a mistaken assumption that most of our money comes from the Gates Foundation. It does not. A substantial part does. But we get from the National Institutes of Health in the USA, the Wellcome Trust, the Canadian IDRC. We get from multiple other agencies, including WHO and others as well.
And this license cancellation
has
affected,
other than UN agencies, all other funds are blocked. The existing funds which we already have received are blocked. The new approved grants are blocked. The worst part of it is money that is owed to us for reimbursement of services already performed, research already performed. On the basis of reimbursement basis, some agencies pay. Those invoices have been approved, but the money can't come in and might actually lapse by October if we do not receive that money. So we have been suffering in 3 different ways, which means that many of our programs of technical support to central and state governments have come to a freeze. We have tried our best to continue them using some of our endowment funds, but it can't go on further.
What percentage of work would have stalled completely?
We had a technical strength, a total staff strength, including a technical strength of 700. Our total staff strength was about 1,000. And now we are down to about 500.
So almost 50% of your workforce is now redundant, so to say.
And by December, it will dwindle further.
Okay. You were the technical support group on the Indradhanush project that you spoke about, and now that project has been moved entirely to John Snow Incorporated. Seems a little bit of an irony, you know, in this context when we are talking about foreign funding being a question mark. How do you look at this entire move?
Well, it's for the government to decide what is best and what works best for it. But it is a little strange, as you have said, that from a Indian organization started by the Ministry of Health and linked to the Ministry of Health providing technical support, funded by the Gates Foundation, we have now moved to an international consultancy group, but with the Gates Foundation funding remaining intact. So from Indian foreign, we have moved to foreign.
But sir, do you think, you know, in all of this, you know, even if John Snow Incorporated is working on that, the technical support part is actually suffering? The work that Health Ministry would have wanted would suffer?
I will not comment on that because it's for the Health Ministry to judge whether it's being well served or not.
Okay. As far as the other programs that PHFI was working, which are the other key components that have, you know, suffered because of paucity of funds?
Our work on universal health coverage in 2 of the southern states has suffered. Our work on HIV/AIDS, we were also providing technical support for the HIV prevention program, which was a major program. And there are several other programs involved in maternal and child health as well, which have suffered. So across the board, many of our projects have actually suffered.
What has been Health Ministry's stand as far as these programs are concerned? Because these are very key to the objectives of the Health Ministry itself, and these are Health Ministry programs that you had been taking forward. Is there an intent to move these also to other organizations, or what?
Well, there are some programs which have already moved to other organizations, some programs which I believe they're looking at other organizations for moving. For example, we were supposed to be the program implementation unit for a major school health program, which we assisted the Health Ministry in designing. That I believe that also is likely to move to some other international group.
Okay.
So it's surprising that many vital areas of India's health are now actually going to be supported by international implementation agencies when you have PHFI readily available and was already engaged. But nevertheless, it is obviously programs cannot stop and should not stop. So Health Ministry has to find the best way of getting work done. If our FCRA matter is resolved soon, we hope we'll be able to re-engage with the Health Ministry with full steam. If not, they have to certainly find other partners to do the work for them.
Right. Sir, but do you think, there is lack of clarity as far as policy on FCRA is concerned on the government side? Recently, as of today morning, we saw a report saying that multiple government agencies have seen their FCRA licenses being revoked based on, the paperwork that they had not submitted. And that includes IITs, JNU, it includes ICMR. Where do you see this stand? Do you see PHFI instance being one-off or part of a lack of clarity on the FCRA policy?
Well,
where do you see
where
that?
we differ, and we do not still know the reasons for that, is that while usually the FCRA process issues a notice and then cancels, we did not even receive a notice. A few months after our renewal, it was cancelled without any notice. So I cannot really say what went wrong with us. But as far as the overall cleaning up process that the Home Ministry is doing on FCRA, perhaps they wish to introduce very strong systems. Now, I do not know exactly whether innocent organizations have been hurt in the process, but at least we now need clarity on systems, and if they can introduce that clarity and clearly say these are the do's, these are the don'ts, this is what we expect of you, then I think all organizations can fall into place.
Yeah.
But whenever there is a climate change, there is the danger of hurricanes.
Yeah. And in the entire tobacco bit, there was also this Philips Michael Bloomberg charity, which has also seen some bit of crackdown on the government, from the government.
Well, I was surprised to read that because an ostensibly secret document was revealed by Reuters, I believe, and then the director of the Tata Memorial Center reacted to that. And I think he reacted rightly because, again, it made the argument that tobacco control was against India's national interest because it hurt India's economy. But it also went on to say some strange things like, if you stop people from consuming tobacco, they'll turn to alcohol and narcotic drugs, which there is really no scientific evidence for that. So I think the Tata Memorial Center director was a person who spoke with great clarity and concern because he sees cancer patients every day. So he said the government should actually clarify the stand on this matter, and the government's own policy on tobacco is fairly clearly enunciated. Then why is it that these kind of memoranda are being produced, which ultimately target NGOs who are working for the government policy?
So which means that government's own tobacco policy is not in line or in place?
See, I would not say that of the government. The government's policy, I think, is fairly clear from the documents that the government has published. Whether it is the National Health Policy or the Niti Ayog's 3-year strategy. I mean, I think even the Prime Minister has gone on record very clearly saying that he would like tobacco to be controlled. But there are groups within the government, it appears, who are actually listening more to the tobacco industry than to the rest of the government.
Right. Sir, I know we're running short on time, but I can't let you go without asking you on the entire health policy, the latest health policy that has come out. We have had certain conversations on that. You are a proponent, and you are a proponent of the universal health program. Do you see bits of your presentations that you've made over the years to the government make way into the health policy? And where do you see the entire health policy stand vis-a-vis the things that we've seen happening in the last 6 months?
Again, I would like to say individuals are inconsequential, personal credits are immaterial.
No, that was a presentation from PHFI.
Yes,
so
no, actually it was a presentation from an independent committee constituted by the previous Planning Commission. So some of our recommendations did go into the 12th five-year plan, but I'm very happy to see that several of our recommendations have gone into the National Health Policy.
Okay.
There are some areas where I believe some more clarity is required, but I think substantially the commitment to a comprehensive primary health care led universal health coverage has been made with the promise of increased public financing. I think those are good developments, and I hope that the policy will be implemented in earnest.
But what are the points where you feel that the policy has failed as far as being an overall and a comprehensive policy?
No, there are certain areas of lack of clarity. Like, for example, it is said that primary health care would be the financing would be done through what's called a capitation fee, which is a bundle payment mechanism for a bunch of services. whereas secondary and tertiary care would be done on the basis of strategic purchasing from public, not-for-profit and private sectors. But unless you link primary, secondary and tertiary care into that bundle payment system, it doesn't work.
It doesn't work. Sir, just in the light of the recent Gorakhpur tragedy, then we have had post that something in Jharkhand, something in Rajasthan, and we are seeing that the entire machinery as far as primary health, secondary health care and the government public system has almost collapsed or on the brink of collapse. In that light, do you think the expenditure of 2.5% by 2025 really makes sense for the government, and where is it that the government really needs to step up now?
I believe we need definitely more money. The fact that 2.5% has been targeted for 2025 is helpful but not sufficient. So we ought to try and move towards that figure sooner than even wait till 2025. Why not till 2022, which is one of the major developmental milestones that we are looking at. So we ought to really, but more importantly is what we spend it on. If we spend it on strengthening urban and rural primary health care, particularly strengthening rural primary health care that exists and create urban primary health care because it doesn't really exist, then we can actually make huge gains. And of course, providing a good health system support through essential drugs and diagnostics that are available free of cost at public facilities in primary health services, strengthening district hospitals, ensuring that we do focus on rapid expansion of health workforce, particularly technology-enabled frontline health workers. These are some of the things that we ought to do as quickly as possible. Tragedies like Gorakhpur occur not only because medical college hospitals are heavily overloaded, but mainly because there are no sub-centers, primary health centers, community health centers and district hospitals which are capable of taking care of these problems, which could and should have been handled at those levels.
Those levels, right. And you have been a proponent even of audit of the hospitals, audit of the entire procurement machinery.
We need 3 audits basically. What we need is a technical audit, we need an administrative audit which includes financial audit, and we need a social audit, which also means the community satisfaction levels also have to be gauged. So these audits must go on a regular basis, on a sample basis, then we can build in greater efficiency into the health system. But one of the important elements is the right from policy development to program design, delivery and evaluation, you need public health expertise. We don't have enough public health professionals for that. And again, Gorakhpur and other tragedies like this are exemplary of that. So I think investing in public health capacity is absolutely critical, and that's why the Public Health Foundation of India was set up in the first place.
Right. Just as a last question before I let you go, where do you think the government is headed with its entire health policy is concerned, and what would your request to the government be vis-a-vis PHFI, vis-a-vis the entire health policy? Briefly.
No, I believe the national health policy is headed in the right direction, but we need to speed it up. But most critical element is to bring the states on board, because the implementation is going to happen in the states, get the buy-in from the states, encourage innovations by states in implementation, but have a broad agreed framework which can unite the nation around the new national health policy.
So the competitive federalism that NITI Aayog is talking about would be a positive step in that direction.
See, competitive federalism and complementary federalism are very important. So it's not just a competitive federalism, it has to be complementary as well. I mean, for example, if you need portability of whatever health insurance program that the government wants to provide, so that a person born in Chennai, educated in Hyderabad, working in Delhi, like me, can have access to healthcare irrespective of where the Indian is located, then I think we do need all the states also to work together. So they must compete, they must complement, but all around a reasonably well agreed objective, even if some of the innovations and mechanisms differ.
All right. Professor Reddy, it's always a pleasure speaking with you. Thank you so much for your time here on CNBC TV 18.
Thanks a lot.